Listen to this. A new study suggests that some children can actually recover from autism.
Yeah, Leo Lytle was diagnosed with the disorder as a toddler, but by the time he turned 9, he had overcome it. And now breakthrough research funded by the National Institute of Mental Health finds that Leo is one of just 10% of kids with autism who have been cured.
Wow, this is fascinating. Dr. Alana Levine is spokesperson for the American Academy of Pediatrics. Good morning to you.
Good morning.
This is groundbreaking. So many parents are probably paying a lot of attention right now. Tell us about the study and how can these kids actually be cured?
Well, I think in order to understand the results of the study, you sort of have to understand the autism spectrum disorders in general. There are a spectrum of disorders, and the word spectrum is key because it means that there's really a variety of symptoms and a spectrum of severity. And these sort of disorders affect children in terms of communication, in terms of social interactions, and in terms of behaviors.
Well, some of the things that Leo had, which was interesting, as he would spin around in circles, he wouldn't make eye contact with people, and now he's a socially integrated child in the third grade, which is fascinating to me. Did he ever have autism?
Well, it's difficult to say, having not treated him or ever really examined him, but what I think people have to understand is that what we do know is that early diagnosis and early intervention is key. So we as pediatricians and parents really need to be careful to look out for the warning signs and look out for the symptoms in communication, the repetitive behaviors, the abnormal social interactions, and intervene early. And we do know that if we intervene early and give them appropriate behavioral therapy, they can have an improvement in their symptoms.
Important to note, not all kids can be cured, but what is the key ingredient in this treatment?
The key is to identify it early and to really follow through with the treatment. So,
and what is the treatment?
So there are a variety of treatments. The most common one that's been very successful, is something called ABA therapy, and it's very intensive. And it really looks at each child as an individual, their symptoms, what they respond to. It uses positive reinforcement to reach the children and really help them cope every day in the world.
That's remarkable because it's so important, I think, to look at children on an individual level, because we've seen other studies that have seen children being cured, anywhere from 3% of children being cured up to 25%. So individuality is important.
Individuality is important. I think we really have to be careful that when we look at studies, you really want to look at large studies, not small studies. So the NIH right now is doing something called the Children's Study, and it's going to look at over 100,000 children across the country from birth to age 21. So it's really going to have a long time to study these children, and they're looking for genetic causes, they're looking for environmental causes, not just for autism, other learning disabilities, obesity, and things. So it's important to realize how powerful the studies are.
It is, Doctor. We appreciate it, and it is a glimmer of hope with the genetic link to autism. This is good information.
Absolutely.
Thanks for being here.